Now we bring our symposium's discussions to a close, and it's my absolute pleasure to introduce Dr. Rebecca Beck Cooney, Chief Editor of Nature Mental Health. Dr. Cooney earned her Ph.D. in psychology right here at Stanford, studying the neural underpinnings of mood and anxiety disorders. She then continued this research at Columbia University and the New York State Psychiatric Institute before moving into the world of scientific publishing. And we're thrilled that she has done this in another important way to disseminate the work and make a difference. She's held senior editorial roles at major journals like the Lancet and the Annals of the New York Academy of Sciences. In 2022, Dr. Cooney became the founding editor-in-chief of Nature Mental Health. Under her leadership, the journal has quickly become a leading platform, bringing together diverse fields like neuroscience, psychiatry, psychology, and public health. We're thrilled to have Dr. Beck Cooney join us today. Her perspective is sure to be inspiring. Please give me a warm welcome to Dr. Beck Cooney.
Thanks for that very kind introduction. It's such a pleasure to be here. This is one of my happiest places on earth because of the time that I got to spend here. And it was about 25 years ago exactly when I started as a grad student in psychology. And I had the great honor of working with Ian Gottlieb there, but I also trained to do fMRI scanning with Brian Knutson. Alan Schatzberg was on my dissertation committee. Laura Folland-Ross and I spent many late nights together at the Lucas Center scanning participants back in the day. And so I have very deep roots here, and it's wonderful to be here with you today. So to give you a little bit of a different perspective on the work that you've been seeing today, and that this is a fabulously richly diverse group of people here. So it's been wonderful to hear some of the side conversations. To give you a sense of what is going on sort of from the perspective of publishing and the what we would think of as sort of the corpus of knowledge as it expands. And when we decided to open a new journal and to call it specifically mental health, that was a very strategic decision. And the reason why was that we didn't want it to be exclusively psychiatry research. We wanted to sort of open up the idea of also including things like positive outcomes and outcomes like resilience and recovery and remission and all of these sort of parts of the chronicity of mental health across the lifespan. There's also been sort of this artificial barrier, depends how far you want to go back and talk about neurology, but that brain health and mental health were somehow two very divorced topics. And so I think AI in particular has made us reassess that. And so, and our journal in particular has always wanted to be very open to research that blurs those lines a little bit. So here are just a few observations. I'll be very quick because I know it's the end of the day. There's a Japanese koan that says, "How do you put the ocean in a bottle?" And I feel like today is very much evocative of this notion that there is so much out there that we're trying to distill into something that we can grasp. And the idea of artificial intelligence itself is very overwhelming. And then even sort of putting it into artificial intelligence in the context of psychiatry or mental health science is still a really overwhelming challenge. But I want to kind of use this sort of as a backdrop, a metaphor of, you know, what is relevant to us? Are we able to sort of capture and come up with bite-sized or digestible ways of absorbing this information and coming to really good conclusions that are actionable, that can affect policy and that actually change lives. If you look very conservatively at just the last 5 years of publications for AI and psychiatry, This is a really quick and dirty approach, and it's a very conservative approach because this is just using data from PubMed. And if you think about what is actually in PubMed, those are indexed journals, for example, so that might cut out a whole swath of journals that also publish work that is relevant on here. But you can see, even as we're now in Q3 of 2025, we've already surpassed the number of publications that we had last year. Why I think this is important is because I think we are at an inflection point. And why is that important? In that, on one hand, that could be very, very exciting, and it means that science is accelerating. On the other hand, there are concerns and risks that, especially those of us who are editors and are on the receiving end of a lot of this, have to be concerned about in terms of mitigating, and what that means in terms of allocating resources to this, what that means in terms of being a sort of an author service extension of what we do. So something to consider. And that's really just using very broadly, accessible terms like AI and psychiatry. I think of, at this point, the stage where we are, and this is really just sort of my assessment, is that we have kind of 4 buckets of general types of AI work that bears on mental health science and psychiatry research. And specifically, that's your natural language processing and LLMs. We have machine learning and sort of deep learning as sort of a subset of that. Wearable sensor data analysis, also computer vision, which you actually got to see some of today. So that was really exciting that came to fruition. What's interesting about this for me is that, by and large, the majority of the papers that we are seeing are machine learning papers. And what I will just kind of point to here is that in terms of AI themed content that we've sort of bundled this year in 2025, we've had 3 sort of cover issues that bear on this. And actually, digital twins is going to be, that's sort of the theme issue for next month's issue that comes out on October 9th. So it was great to hear some of the work there as well. But these have been just sort of organically from de novo submissions that have come to us. We haven't sort of, done a call for papers or anything, but that's 3 issues out of 12 that sort of bear on this. And this is just a quick snapshot of what we have published the year to date of papers, specifically with machine learning. And nearly a third of the papers, of primary research papers that we've published, have been machine learning. And I was actually thinking back to the first time I heard the term machine learning was in the psychology department about the year 2003, when Paul Hamilton, who's now at the University of Bergen, but it was a postdoc at the time, who's a very excitable guy, came and was like, guys, stop what you're doing. We have to learn how to do machine learning. And at the time, we had begged Ian to get us 1 terabyte of storage. And we were very, very proud. I was very chastened to find out that now you can get a personal account at Stanford for 5 terabytes of just personal data space. So this explosion of work in an area that I thought, gosh, I'm never going to have to deal with that again, especially doing sort of more medical science in the past 10, 15 years. And now it's here back with a vengeance. And so that's a lot of machine learning papers. We're a team of 4 people. And I know this is completely unreadable, but just to kind of give you a sense of the different domains of machine learning. So this isn't just strictly brain data that is being subjected to is probably not a good word for this, but that are being treated to machine learning algorithms. But there's a lot of really interesting ways to use this. And so, for example, looking at caregiver adversities, we have social determinants of health, COVID and loneliness, psychiatric vulnerability, bipolar disorder, DTI. So this whole panoply of different applications where we're seeing people using machine learning. At this point, I think it's sort of going to become another sort of statistical tool that we use. And I wonder if, say, 5 years from now, if people will even use machine learning in the title of it, you know, or put it in their abstract, because it might just become so routinely used and regularized that it's just par for the course. So I just wanted to share that with you. So, and again, these are just sort of de novo submissions. We haven't done anything specifically to try and bring this content in. But what is important for all of you to know is that our AI exposure, so not just machine learning, but across the board, is increasing faster than our fluency as editors to be able to parse that. And that is very important because this really calls into question issues about, you know, how do we staff journals? How do we do peer review in a way that is equitable to you? If we aren't able to keep up with that methodologically, how are we supposed to be able to evaluate these papers? Because at every stage of the process, we have to be able to know what we're doing with those data. How are we processing when we bring content in? What is considered good? What is considered sort of a mediocre machine learning paper? Deciding what gets sent out to review, who we invite as peer reviewers. And this is becoming increasingly more difficult as people realize that they may not have the skills in order to evaluate a paper. So we have to think too, from the equity perspective of the academic world, is how to make sure that information that would be useful to other reviewers is there and accessible to them. And finally, when we evaluate reviews and revisions of papers, you know, I know to look for a few things. So tenfold validation versus cohort validations, but things are moving so quickly that, you know, by 2 months from now, a lot of this information might be obsolete. So these are things to think about, is the way that machine learning, AI in general, can be sort of this double-edged sword that could inadvertently decrease equity in some ways. So we really need to mitigate against that. And I think that sort of doing more micro conferences to get people together who work on topics and then bring people from different disciplines together to work on those projects to understand how to methodologically communicate with each other is really important. And as well as bringing people with lived experience into that process. And then how do we sort of present those findings? And so finally, I'm going to stop there actually a couple minutes early, is just with this quote from John Kabat-Zinn, who you may know, who is the sort of founder of mindfulness-based stress reduction. You can't stop the waves, but you can learn to surf. So I think all of us are learning to surf this sort of ocean of information and publications that are coming out of this process, but we have to do it together. So I will stop there.
Thank you so much, Dr. Cooney, for that excellent perspective. You really also echo the theme of how we need to bring so many different angles and perspectives on moving forward in this new era of AI and precision mental health and bridging those areas with neuroscience. So I will keep it brief in my closing remarks because we're about to have a happy hour and an incredible poster session. But I really wanted to thank you for such an inspirational day. All of you presenting, contributing, the fantastic questions, our distinguished speakers and panel chairs, you've truly been incredible. And we're deeply grateful. And I think we all feel very energized about where we're going in the future. I do want to recognize a few foundational contributions. And this is the Symposium Planning A-Team. So we have their names here and you see them across the top, the incredible scientific review committee who have evaluated the submissions to posters and made the difficult decisions. Also, thank you to those of you involved in the media support and to supporting our presenters and our supporters, and to the incredible Precision Mental Health team, the Center for Precision Mental Health. All of our members are here today. You may have seen them with the yellow badges, and they're very committed to bringing you this fantastic symposium. So it's really been an incredible day, bridging psychiatry, neuroscience, and AI. I want you to mark your calendars for meeting again in 1 year, 2026, September 25th, Friday. We'll be hosting our next symposium. So please join us then. But for now, I encourage you to grab a refreshment, walk around, speak with the presenters, the contributors, all the people who are here. All of you are making this groundbreaking work possible. Thank you.